Good morning. My name is Brian Wheeler, Director of Communications for the City of Charlottesville. Welcome to Cville360, a program to inform and engage the Charlottesville community. During the coronavirus pandemic, the city's leadership knows you want to hear from us frequently about our actions. We also want to hear from you and provide opportunities for engagement. We've launched this program on our streaming sites, Comcast Channel 10, and on a companion Zoom webinar so you can tune in live and on demand while practicing social distancing. The webinar allows you to join the broadcast and ask questions of our guest. If you want to try the webinar, visit charlottesville.org/Zoom for the registration information. A link to each show appears at the bottom of the page. At the top of each show, we will have a brief update on the state of the coronavirus and the city's response from the city's Fire Chief, Andrew Baxter, who joins us today via webinar. After the Chief's update, the remainder of the program today will focus on the city budget and a review of the discussion about last night's first ever all virtual City Council meeting. On the webinar, you can type your questions at any time in the Q&A module. You can also click the raise your hand icon and I'll bring you onto the program directly to speak with our guest. So we're going to start today with Chief Baxter. I want to welcome the Chief back to the show. And Chief, I just unmuted your microphone. And let's make sure we can hear you and see you. Just give us one moment here. There he is. Chief Baxter, we can see you now. And
Good morning, Brian.
And we can hear you.
Back on the show.
If you could go ahead and tell us what's changed since your briefing last Thursday, and what do we need to remain focused on to stay healthy?
Sure. So our strategic goals remain the same, providing essential services to the community, identifying and supporting our most vulnerable populations, protecting our first responders and our other essential employees that are out there working, social services, human services, many others as well. And then overall trying to sustain the health system by flattening the disease curve, a phrase that I think everyone in the United States is very familiar with at this point. I can give you an update on the case numbers. As of yesterday afternoon in the Thomas Jefferson Health District, we had 222 cases with unfortunately 11 fatalities. There are currently 64 COVID positive cases in Albemarle County, 41 in the city of Charlottesville. And then within the district, again, we talked about the other day, the largest number of cases or bloom remains in Fluvanna County. The vast majority of those coming from one licensed care facility in Fork Union. In terms of our regional focus at the Emergency Operations Center, we continue our daily coordination with our long-term care facilities in the city and the county. There's a regional task force that meets every day to talk about the current status and is the strategy working, and making sure that those facilities have the guidance and the supplies and the equipment that they need, and that they're enforcing their no visitor policies and other policies like that. Within the last few days, we've taken some additional steps to protect a particular subset of our homeless population. Our folks identified approximately 30 individuals that were homeless that also had significant medical comorbidities, other pre-existing chronic conditions, for example, diabetes, heart disease, hypertension, asthma, COPD. And the guidance we received from the health department and from other medical experts was that in order to provide the safest possible environment for those folks, that we would put them in individual hotel rooms. So that process has been put in place and is being executed as we speak. So those 30 will also be then in a much more protected environment where we can provide really targeted services to meet their very specific needs. So within the next few hours, our community will see some information come out about a volunteer and donation management site that's being set up at St. Anne's Belfield in front of the preschool at the Belfield campus, starting tomorrow, Monday through Friday from 12 till 3 in the afternoon. There will be a staff there to collect donations, and the items that are being solicited are what we've been talking about for a number of weeks now: surgical masks and gowns, head and shoe covers, gloves and medical and non-medical grade, face shields, safety glasses, N95s and other respirator type masks, and then surgical and dust masks. And then there's on that list that people will see on our media and social media accounts as well. The Thomas Jefferson Health District is working very, very closely on a really upgraded testing capability for focusing particularly on long-term care facilities and our corrections facilities. And then also at the regional level, we're beginning to work on recovery and really probably a better term is transition planning, because we're not going back to pre-COVID. This is going to be a new normal, and we're going to have to structure that. So our city IMT, the county incident management team, and our regional emergency operations center planning team are working together and trying to answer some of the questions. What are the triggers to move to that next phase? What can we learn from other communities in the United States that are ahead of the curve and around the world that have already lifted some restrictions? And how did that work? What worked? What didn't work? What are the consequences of lifting those restrictions too early? A really important question that we have not yet answered is what level of testing will be required in the community to be able to begin to relax those restrictions. On the financial side of things, we're working very, very hard to make sure that we're leveraging as a region and as localities available funding through the CARES Act, the FEMA Public Assistance Program, some other grant programs as well. And we did receive last week, our first funding from the CARES Act specifically for COVID-related expenses. In particular, we're using that to cover expenses for PPE acquisition. So that's pretty much the data and the regional focus at this point, Brian.
Thank you, Chief. I think a few things bear mentioning again that we've talked about on previous programs, but the regional effort that's underway. City council, the city manager often receive questions. People want to know how well is the city, county, and UVA working together on this, and with the health district, the lead agency. I can speak from my personal experience, Chief, that the communications team is small in the city. We have 4 staff right now, and 3 of us are here in the studio. But my 4th staff member, Lasheen Parks, is deployed over at the Emergency Operations Center. So there are city people involved in helping communicate about the health district's public health messages. And so some of the communications you were just talking about are going to be contributed by city staff and Albemarle County staff who are working in the Joint Information Center there. But could you shed some light on who else, if people were to walk into the Emergency Operations Center, what types of people would they see and what are they doing?
That's a good question, Brian. It's very important for people to understand that within this regional structure, all 3 entities, the city, the University of Virginia, and Albemarle County, provide staff to fill those critical positions. There's one person in the region whose full-time job is emergency preparedness at the regional level. So all of those positions are then by definition filled with people from the 3 partner entities. And so you would see, if you walked into the Emergency Operations Center, a command table where the 4 of us that are members of the Unified Command, representing the health district, city, county, and the university, meet with appropriate distance between us. The lion's share of the work takes place really in the operations section and the planning section, and there are sub groups and sub people underneath of those that are working on specific issues. The critical thing for them to do is to track information and provide information, and then resources. What do we have? Where is it deployed? Is it working? And then they're also really critical in making sure that we have good situational awareness at the strategic, tactical, and task level across the entire region, and that's a real Herculean effort, and it takes an incredible amount of time and expertise to make sure that we've got that down pat, because we don't want to miss anything. We don't want to miss a vulnerable population. We don't want to put providers in a situation that's unnecessarily risky. We want to make sure that things are coordinated at a regional level, if that's what makes sense. So it's a pretty complex process.
And Chief, is there any update you can provide on our peak case date, when we think that's going to happen?
Well, it's interesting. I read an article yesterday, and many people may have heard this quote as well. It says, all models are wrong, but some models are useful. And we continue to rely on multiple models. The UVA Biocomplexity Institute model, which came out last week in partnership with Rand Corporation, that really incorporated Virginia data, University of Washington, University of Pennsylvania. There's a number of others. I think the most salient point here, though, is that the social distancing that we're engaged in now, that physical distancing, it is working. I don't think anyone at this point can safely say that we're on the downside of this slope of this curve. In fact, it's important for people to understand that what we've been talking about really in the last week has been noting a reduction in the rate of rise as opposed to an overall reduction. And we would need to see, in order to take that step into really what we call phase 2 of a phased lifting of some of these restrictions, we would need to see a drop in cases consistently over a 14-day period, which is the incubation period for the disease. And we're not even close to that yet. So it's still sort of a work in progress, understanding where we are.
Thanks, Chief. Before we wrap up this segment, I want to make sure the audience knows they can raise their hand if they have a question, or you can type something in the Q&A module. I can also share that the Thomas Jefferson Health District will be having another town hall on Friday at 3 o'clock. If you want to tune into that webinar, you can visit the city's calendar on our website at charlottesville.org/Zoom, and you can register for that town hall. That'll have Dr. Denise Bonds, and the health district's been really good about helping address the questions about things, about testing, about contact tracing, and some of those issues that we hear about in other communities, and people want to learn how we're taking care of that in this community. Chief Baxter, any final comments you'd like to make?
Sure, just to reinforce the guidelines we've been talking about now for quite a few weeks. Stay home unless it's an essential activity. Hand hygiene with soap and water preferably, and if not available, hand sanitizer. Cough etiquette, wearing a cloth mask in public, and please, if you're not an essential first responder, healthcare worker, essential worker in some way, shape, or form, medical grade N95s for folks that are in those critical roles. We have not reached our peak. Life safety, particularly of our most vulnerable residents, remains our top priority and drives everything that we do. And then finally, please stay connected. There's a lot of ways to do that now that didn't exist decades ago. So call, write, text, social media. Please check on your neighbors, particularly your most vulnerable neighbors, and we will get through this.
Thank you, Chief. So next we're going to change gears and focus on City Council and the city budget. And in studio, I'm joined by the City Manager of Charlottesville, Dr. Tarron Richardson. And via webinar, we have Michael Payne, one of our members of City Council. We're going to start here in the studio with Dr. Richardson. And, last night was an interesting night.
Yes.
City Hall was locked. There were 3 people in council chambers. Us. David Dillahunt was behind the scenes, managing the TV broadcast. And yet we still had a city council meeting. And it was all virtual for the first time ever, as far as I know, that a webinar was done for a city council meeting. And we blended that with our TV broadcast, all in an effort to, maintain social distancing, keep council healthy, keep our staff healthy, and at the same time, keep government up and running.
That's right.
So what was the overall goal heading into last night's council meeting?
Well, the main thing going into last night's meeting was basically to make sure that we covered some deadlines, talked about tax rates as well as our financial plan for fiscal year 2021. And I think that we did a great job in terms of covering those key items and really just trying to establish a path forward. As you know that our schedule was derailed by COVID-19, and then the plan is to get us back on track so that we can meet our adjusted timeline to adopt our fiscal year budget for FY21.
And so obviously revenue shortfalls are a key driver for all local governments. Before we put those numbers on the screen, I wonder if you could just talk about that challenge. And this all happened right as you were handing your very first budget to City Council.
Exactly. We've been through some trying times. We have a lot more challenges ahead of us, but I think if we continue to work together as a collective group, we'll get through it just like anything else. And the budget that I was planning to forward to council, my first proposed budget for the city of Charlottesville was about $196 million. Well, we had to revise that, and those numbers were shown to City Council last night, as well as during our 221 meetings to talk about where we're at moving into FY21. And then, now the revised budget is around $191 million. So that's a $5 million loss in terms of revenues. But beyond that, you also have to look at where we currently are. And the adopted budget from the previous fiscal year was about $188 million. And then moved into, after the coronavirus, reared its head, we went down and made some adjustments so that we could be within, make sure that our revenues were able to cover our expenditures. So we adjusted the budget down to $185 million, which is about a $3 million loss. So we had to do some quick trimming, but as always, I like to stay optimistic, and hopefully things will change in the very near future, and where we can get back on track and make sure that the way that the direction that we were going for FY21, we can get back to that.
Let's put up some of those numbers on the screen here. And you can see that Dr. Richardson was talking about fiscal year 20, and that's important because the city's fiscal year runs from July to June. So the pandemic started, halfway through the current fiscal year 20, and the expected revenue shortfall is $3 million in the current budget. And then as Dr. Richardson said, we are projecting a $5.4 million shortfall from our expectations about revenues for the next fiscal year. So those things require adjustments to the budget. And let's look at the next slide, which has some of those key drivers when it comes to local taxes. One of them is the sales tax, then of course the lodging tax and the meals tax. Those are three of the biggest drivers, and that's because fewer businesses are open selling things, fewer hotels are having people in them, and fewer restaurants are serving meals.
And another key component of that also is the closure of UVA. We were expecting the students to be here, and then with all the events that come with UVA, to be able to bring money to our city in terms of lodging, sales, as well as meals tax. But as you can see, in a lot of those areas, as we've mentioned here, and as you can see, the overall reductions that we're looking at in FY20 as well as FY21, we had to make those adjustments because those things aren't, a reality at this time. But, as I said, we're going to stay optimistic and we're going to hope for the best.
Awesome. Well, let's bring on Michael Payne, member of City Council. And Michael, let me share your video here. All right, can you still hear us, and can we hear you?
Yes, can you hear me?
Yes, we can. So last night, Mayor Walker started the meeting by asking each member of council to make a statement about where we are as a community. And I wonder if you could maybe share your perspective on that and what you heard some of your colleagues say about the current challenge.
Well, I think our first priority continues to be the health and safety of the local community, and to continue to amplify the importance of social distancing, following the CDC's recommendation, wearing cloth masks in public, only working if you're an essential employee, try to limit your trips to essential trips only, because we see that those social distancing measures are working in terms of flattening the curve. Again, we're not done yet, but it is working, and I think it's helped our local community avoid a significant outbreak and public health crises that we've seen in some other cities across the country. So that continues to be the first priority. The second impact is just the economic crisis that the pandemic has created. We have people reach out to us daily as individuals, as small businesses, as nonprofits who are experiencing economic crises of their own because of what's happening. And so a major priority for us on council is to just try and address those issues and do what we can as a locality to try and limit the negative impact of the economic downturn that the pandemic has caused, as well as to try and, as much as we can as a locality, make it easier for people to stay at home and not have to worry about having to leave their home in order to deal with economic necessities. When it comes to the budget process, we just continue to work to try and get a budget finished by the deadline that's mandated by the state at the end of June. I know that the city manager and city staff has been working very hard on that. We're on an accelerated timeline, and there's obviously a lot of uncertainty in this budget process. And when we're looking at downward projection of revenues of over $8 million across fiscal year 20 and 2021, that means, significantly revisiting the budget, and it means significant trade-offs and difficult decisions will have to be made. So we really want to make sure that the community is engaged in this budget process so they can understand the trade-offs that we have to make and help inform us about what kind of trade-offs that they would like to see us make. And finally, I'd say one of the major challenges for us on city council is just that we have people reaching out to us all the time about the problems they are facing. And what's frustrating is that as a locality, we just don't have the resources and legal authority to meet every need. We're doing everything we can, but it's difficult when you see small businesses going out of business, when you see people who have lost their job with no source of income, folks who have lost health insurance, who are facing homelessness and food insecurity. And I think it's really going to be important for there to be bold action at both the state and federal level, because COVID-19 is exposing in many ways a lot of longtime problems we had in this country with our economy and our political system as well. When you look at the weakness of our social safety net, when you look at the lack of investment in homelessness services and housing and healthcare, even when you look at things like the shortage of testing, personal protective equipment, masks, this is due to outsourced supply chain networks, and other weaknesses in our economy that are vulnerable to shocks. And so we are trying to work with partners at the state and federal level to have that investment happen at those levels and take advantage of those resources when they become available. But for us, that's definitely a huge thing, is that to meet every need will require resources beyond what we just have as a locality.
Thank you, Mr. Payne. Clearly, council members are on the front lines talking to members of the community, and so are city staff. I mean, we get those phone calls and emails as well. Remind folks, though, just about the budget and the meeting last night. What were the key decisions that council had to make in order to get the process moving again?
They were basically four. One talked about establishing June 30th as our fiscal year budget adoption deadline. As you can recall, I called a declaration of emergency for the city, as well as the council did an emergency ordinance to basically waive statutory deadlines. So with all those factors in place, we were supposed to, based upon the code for the city, we were supposed to adopt by April 15th. But mandated by state code, we were supposed to adopt before July 1. So the date that we put in place, established as the adoption date for the city now, will be June 30th. But we're planning to adopt before that, probably in the early part of June. So that was one. And then the resolution establishing the calendar year for the tax rates. That was another item. And what that basically was just, basically establishing the tax rates. But since we didn't adjust them the previous year, that tax rate could move into the next year because we didn't make any adjustments. So we were able to do that. And then also too, establishing the deadline for tangible property as well as real estate, machinery and tools taxes, extending that deadline to June 19th, which the deadline was June 5th. But as the mayor said last night, we wanted to make sure that we do put people first and understand that this is impacting everyone. So with that said, I've talked to our treasurer as well as our commissioner of revenue to talk about some extensions that we could do, as well as setting up payment plans. But just like with anything else, we strongly encourage, our residents to contact their offices and to set up these payment plans prior to the deadline. And then, throughout that process, if things happen throughout their scheduled payment plan, that they do keep in contact with those offices to make sure that their accounts are current. And then the last item was talking about the financial plan and also the dates that we have in terms of, moving forward with the budget. Now, last night was our first meeting, and that was our city council meeting, just establishing those things that we talked about. The tax rates, budget adoption deadline, and the overall adoption plan. And as you can see, between those two dates, between last night and May 18th, we wanted to make sure that before we had the public hearing, that we're having a number of meetings in between those times, having discussions with the school district, having a discussion with our directors, having the discussions with the public, making sure that everyone has some input into the budget process before we get down to the budget approval date. And as we talked about, the impact of it and the revenue loss and the impact that's going to have on the city departments. We want to make sure that we are covering all of our bases, because we know going into fiscal year 21, there were certain things that departments had to purchase that were essential for their day-to-day operations. And because of that, we want to make sure that those particular items are purchased within this fiscal year 21. But just like anything else, you're going to have, the department's going to have to give up something to be able to fund those various items. So as I said before, the whole goal here is to put people first, to make sure that we're taking care of our most vulnerable populations, as well as our employees. And that was one of the key items that council talked about last night, was taking care of our employees. And that's what we've been doing throughout this process, and making sure that our employees are still on the payroll. And that's something that has been very strenuous on us and my great budget team that I have working with me to put together this fiscal year 21 budget to be able to look at that and make sure that our employees are working as long as they can.
Great. Michael Payne, let's bring you back to the conversation. So you've heard Dr. Richardson remind the community about what last night was about, setting the tax rates, getting the budget calendar fleshed out a little bit. But there's a lot to be learned between last night's meeting and May 18th, when there could be a public hearing about the budget. What are the types of information, nuggets, gaps that you think need to be collected and filled?
Well, one thing we're doing is trying to get information from our nonprofit community in Charlottesville, as well as individuals who are being served by those nonprofits, because one of the goals with our Vibrant Community, formerly ABRT process, is, are there any ways that we can gear that money towards addressing some of the most urgent work that's going on in the community in terms of frontline immediate responses to the impacts of COVID-19. Things like programs that are providing food for individuals facing food insecurity, organizations who are dealing with homelessness or people who are facing perhaps homelessness for the first time, and seeing if there's any way that we can gear our investments again towards addressing some of these immediate crisis issues that the pandemic has created. So we're looking to get some more information to figure out exactly how we will allocate that money in the Vibrant Community Fund. We know it's going to be the same amount of money as fiscal year 20, but we just haven't quite figured out the most strategic way to invest all of that money yet. Another thing we're looking to get some more clarity on is the capital improvement programs, or CIP budget, which is where a lot of major infrastructure projects happen, like West Main Street Streetscape or the Belmont Bridge, et cetera. And there's a lot of uncertainty around that just because of, a lot of those projects, some are funded with municipal bonds, some aren't. But for those that are financed by municipal bonds, that's a very uncertain market right now. So there's question marks about our ability as a locality to issue municipal bonds and exactly what our capacity to do that is. So that's something, city staff and city leadership are continuing to monitor and trying to figure out what, if any, CIP projects can continue this year, and what's the most strategic way to gear and develop that budget this year. We heard last night that, at least at this point, the redevelopment of CRHA properties and the redevelopment of Friendship Court in the CIP budget are not affected, again, at least at this point. But we are really trying to just get out and hear from the community about what things people are seeing in the community that the city could help invest in or amplify, as well as to really be proactive about communicating with everyone in the community, as we're doing today, letting them know exactly what the budget situation is, being honest and transparent about them, and letting them see exactly what the trade-offs are and exactly the kind of decisions that we have to make, so they have some buy-in into the process and understand what we're doing. And when you have a budget process that's as uncertain as this one is, where you're having to face as much cuts as we are, I think that's really important. And I know that's something that through allowing public participation at our meetings with Zoom webinars, through programs like this, as well as efforts that as counselors we're taking on social media and connecting with neighborhood associations and other groups, we're really being proactive about.
Thank you, Mr. Payne. I want to invite the public to ask any questions they have. You can raise your hand in the webinar and we'll bring you into the conversation, or you can type a question in the Q&A module. If you're listening via another platform, you can still join the webinar and go to charlottesville.org/Zoom, and you can get the registration information and join us that way. Nobody has raised their hands yet, so I'm going to go back to Michael Payne. And Mr. Payne, a number of the issues I know that you've been very passionate about, whether it's climate change, housing, there were a lot of community expectations built up throughout last year, and there was momentum in the budgets that the city manager and council had previously approved. How do we recalibrate our expectations in this environment of uncertainty?
Mm-hmm. Well, again, we're in a situation that is unprecedented within our lifetimes of facing a pandemic, which has created an immediate public health crisis. And as an impact of that health crisis has created an economic crisis and a significant amount of uncertainty in terms of how our economy will be, not even just 6 months to a year from now, but even 3 weeks from now. And I think the community and people understand that this is really an unprecedented situation, and our first priority continues and always will be public health and safety of the community, and we are going to make that our number one priority and gear our investments towards maintaining and ensuring as best we can the public health and safety of our community. In terms of recalibrating expectations, again, we're facing across fiscal year 20 and 21 a downturn of revenues from what they originally projected of over $8 million. We've got a budget around $190 million. Unlike the federal government, we obviously do not have a central bank. We can't run deficits. We have to balance our budget each year. There's no other option. And $190 million is, even in good years, leaves a lot of needs in the community that are unmet. And certainly when you have a pandemic, which is causing, tens of millions of people who have lost their jobs, who've lost health insurance, who are facing, if they're a small business owner, maybe they've already lost their business or they're facing, extreme uncertainty about the future of it. That for a locality obviously just creates very difficult decisions, and it means we just have to be honest about what's feasible in the budget and be honest about what is necessary to balance the budget. And in addition, we also need to be honest that the priorities in the budget have changed because of the pandemic. Again, our priorities now have to be geared towards meeting some of these most immediate crisis needs that have been created by the pandemic. And, that's just the reality of the situation. And I'll reiterate again, I think that action from a state and federal level is so important because in order to prevent this from having a cascading negative effect on the economy, I think we are really going to need across the country support for local and state governments. We're going to need more money for small businesses in terms of grants and loans. We're going to need support for families to get money in their hands each month, support to prevent people from not being able to pay rent or mortgages. Because when we're thinking about our overall economy, if the federal government is not stepping in that way and people aren't able to spend money, that is going to have a cascading effect beyond just when self-quarantine ends. And I know we saw in 2007 and 2008 that for years after that recession, local and state budgets continued to be severely negatively impacted and never really recovered. And so this is a national crisis, and we feel the impacts locally.
Dr. Richardson, last night you presented to council the idea of starting with the fiscal year 20 budget.
Yes.
To get us back in the conversation, instead of starting with the new ideas that we had put on the table previously, go back a year. And that has some consequences for different departments. And I know one of the things you're going to be working on between now and the next council meeting is touching base with department heads to figure out what is the impact. You also need to go and talk with the superintendent of schools and figure out what the impact is on them. Mm-hmm. So what are those conversations going to be like, and what can you tell us?
They're going to be extremely tough. And as was mentioned previously, this is unprecedented. So the challenges that we're facing are much different than having, a natural disaster or an economic downturn due to the housing market or what so have you. This is long lasting, and the impact of it we can see every day. But as I talked about before, even our conversations, they'll be very trying because a lot of departments, they put a lot of energy into what they're doing and what they're trying to produce in terms of our public services that we provide to the community. Those conversations we'll have. There'll be some things that we have to cut. It just was like when we were doing the FY21 proposed budget. I was saying that we needed to look at our overall expenditures, and make sure that we were being fiscally prudent as well as responsible in terms of the expenditures that we were proposing for the upcoming fiscal year. So there will be some challenges, but also too, as we look at, we'll be having the discussions with our school district. We're trying to schedule for Monday to have our 221 meetings with the district. And there'll be some really tough conversations because, as you know, when we were talking about the overall budget for this year, we were holding it at 59 million plus giving them an extra 600,000 when we were coming out of our preliminary discussions. But taking them back to FY20, that's seriously going to have an impact on the way that they operate for the next school year. because we're going back to the $57 million number. So that's going to be very challenging. But as I talked about last night, was if things start to move in the right direction, what does council want to prioritize? And we're going to talk about that, the priorities. If we see that our revenues are starting to improve, what is going to be that priority list? What's going to be number one that we want to go back to funding? What's number two that we want to go back to funding? What's number three? And then we'll hit those key areas and be able to make those amendments to move forward. But as I mentioned before, I'm always trying to be the cheerleader, as city manager, to make sure that we stay, on a positive note. But if things go backwards and we continue to see our revenues dwindle, then we have to look at it from a different lens and talk about different things that we made to make in terms of adjustments throughout all of our departments, as well as having more conversations with the school district.
And Mayor Walker last night invited council to share each of their top 3 priorities if they felt inclined to do so. And we heard a number of things that Michael Payne's already talked about this morning. You mentioned 221 meetings,
Yes.
and that's when you can meet with 2 members of council at a time at the most. Otherwise, it becomes a public meeting.
Yes.
So people may not know that term 221 meeting, but that's a way that you can keep the conversation going with our elected officials as we continue to refine the budget. Another thing that came up at the council meeting last night was the University of Virginia.
Yes.
Obviously, the biggest driver of our local economy. They've put a placeholder in October for graduation exercise for this year's class. But what are we hearing about students returning this fall?
We're not sure yet. That's still an unknown. But what I'm hearing is maybe late fall going into 21. That the students may come back, but you never know. And as I said before, if conditions improve, maybe they may change and bring the students back sooner. I don't know yet.
Yeah, and Chief Baxter talked about the uncertainty of the models predicting coronavirus.
That's right.
We have a lot of uncertainty on the financial side.
That's right.
You've got a revenue team, a budget team. They're meeting nonstop to revise these numbers. I think one thing that's important for the public to know is that our decline percentage-wise was, half of some of our surrounding localities.
That's right. That's right.
So that indicates we're somewhat insulated to a degree. But
yeah, because I think we're at around almost 3%. And other cities are looking at 5, 6, 7%. But what I want to do is stay, to remain very cautious in terms of the way that we approach this. I don't want to take out any big chunks until we really can understand what is going on, because if we do that, we're going to impact the way that we operate. And as we mentioned, some of the key areas that council mentioned last night that will be impacted. So as I told the council, we'll continue to meet on a weekly basis and throughout the week with my budget as well as revenue teams. And then we'll come back to the council throughout the fiscal year on a monthly basis to show them the impact that the coronavirus is having on our budget.
And we do have a question now from our webinar audience. Neil Williamson, Dr. Richardson has asked, how will the financial shortfall impact your strategic plan for staffing? Is there a hiring freeze? And in particular for him, he's interested in the new NDS director position. What can you say about those things?
It's a lot of questions, but we'll start with the first one in terms of really understanding the impact that it has on our personnel. As I said before, and that's one of council's priorities, to make sure that we keep all of our employees working. Above and beyond that, as I mentioned, we will update the council on our overall revenues and our expenditures and how can we continue to move forward with maintaining our personnel. As far as the NDS position, that's in a holding pattern, as well as other hiring for other positions throughout the city. Now, we're still doing internal promotions, but as far as hiring from the outside, we kind of ceased that at this moment because we want to really have some interviews, in-house in terms of bringing folks here so we can really know who they are and what they're all about. And once we get to that point where things are showing a recovery, then we'll open that process back up.
We have another question on the webinar. Carrie Elwood
Okay.
would like to know if the 2% cost of living adjustment is still going to be part of the budget plan.
Right at this moment, we haven't made that final decision yet, but we will see. We have to take it cautiously in terms of what we do, in terms of providing the COLA. What we probably will end up doing if things don't improve is wait till later in the year and see where things go and then make those adjustments. But that still is it's still one of our target items that we want to make sure that we do have funding to be able to provide that. But right now, that's on hold too.
Let's bring Michael Payne back to the conversation. Last night there was talk about the Housing Advisory Committee and the Planning Commission and whether they should be meeting to help address this crisis right now. What light can you shed on that, and maybe give people a little background about the Housing Advisory Committee and why that's important?
Sure. So part of it is that our boards and commissions can still meet electronically if what they're discussing is directly and only directly related to emergency response to COVID-19. And so that means that our Housing Advisory Committee, the HAC, which is a body that reports directly to City Council. It is an advisory body that consists of community members, housing providers, as well as other folks who provide us with some expertise and policy suggestions around what the city can do on affordable housing. And so the HAC has been involved with things like CRHA's new voucher program, landlord risk reduction fund, and many other policy conversations. So one of the things that got discussed at last night's city council meeting was whether the HAC could come together to sort of brainstorm what are some potential actions that the city and or housing nonprofits could take to meet some of these emergency housing needs that COVID-19 has created. And there are a number of emergency housing needs when you look at folks who were perhaps unable to pay rent in April. A lot of people who are unable to pay rent on April 1st, a lot of people who will be unable to pay rent on May 1st, people who are facing maybe their landlord isn't evicting them right now because the Virginia State Supreme Court has paused all eviction proceedings. But once that pause ends, they're going to be facing eviction and late fees and penalties, the rise in the homeless population, all these other things. And so the hope is just that, because they consist of housing policy experts and because they consist of a lot of our local housing providers, they can give us a sense of what are some of the potential actions that could be taken, as well as to position us for, the city received a little over $200,000 as part of the CARES Act that's coming through CDBG, and that can be allocated fairly broadly for responses to COVID-19. So to get their input of whether, it's a strategic use of money to use that to meet some of the emergency housing needs we have, as well as are there ways that we can position either the city or our nonprofit community to be well positioned to receive grant money or philanthropy that's coming through either the private sector, the nonprofit sector, or through some of these bills that are passing through Congress, especially if there is another stimulus bill, which I know is being discussed right now. And so that's really the goal. And again, they can only meet right now electronically, strictly to discuss these COVID-19 responses. And I think there will be a lot of value for the city, and just even having that be an avenue for the community to brainstorm and get some ideas about what we're doing, particularly I think when it comes to homelessness services, as well as individuals who are facing maybe not immediately, but thinking 3 to 6 months down the line, facing eviction or unable to pay rent and the late fees and penalties that come along with that.
Let's put up on the screen here a few ways that people can stay in touch with the city and keep track of the budget. So charlottesville.org/budget, you can download the current proposals and follow along with upcoming meetings that will be taking place. So we encourage you to check that out. For those in the community looking for assistance related to the impact of the coronavirus on their families, their business, we would direct you to the charlottesville.org/coronavirus page. There, in particular, our economic development team has put a number of resources available to businesses. As Councilor Payne said, it's difficult. Local government has limited resources that it can make available, but we're trying to be a clearinghouse for those state, federal grant opportunities that do exist. So we want to make sure that people are aware of those opportunities. Dr. Richardson, as we finish up today, any final thoughts about where we go next on the budget and what you're going to be focused on?
I'm primarily going to be focused on, as I mentioned before, my primary concern is the people in the community as well as the workforce, and making sure that we maintain our workforce as well as taking care of the people in our community through our public services and different things that we do on a day-to-day basis. As far as the budget, continue to massage it as much as we can, try to make sure that we are looking at every aspect of the budget in terms of the revenues that we bring in, whether it's through grants or different things like that, as well as making sure that we're looking at our overall expenditures and making sure that we are being very responsible in terms of what we do spend moving forward. But as I mentioned before, and as I tell the public also, these are very challenging times, especially what we're dealing with and the amount of revenue that we're bringing in. So bear with us as we work through this, and I'm looking forward to coming out on the other side and making sure that we continue to be a great city.
And Kate Fraley has raised her hand to talk, and Kate, we're going to invite you to join the conversation here. Do you have a question?
Yes, I was wondering, Dr. Richardson, I heard that there were 200 calls a day to the helpline, and then I heard that the helpline wasn't taking messages, but that people were supposed to keep calling back. I'm not sure if there's more than one helpline, but I was wondering how it's going.
Yes, thank you for that question. We've gotten a lot of feedback pertaining to that, and our staff is currently working on that to make some improvements in that area. So I would still continue to contact the helpline, and then if you have any issues, please give us feedback, as many of our residents have, and then that helps us to better serve you.
And Kate, we'll go ahead and put up that phone number for the community resource line, and that's 434-234-4490. And I am expecting some announcements about an additional approach that they're going to start offering related to online submission of people's needs. So be on the lookout for some additional information this week. We will also touch on this issue on Thursday's Cville360 show. Before I preview that, I want to give one more chance to Councilor Michael Payne. And Michael, last night Mayor Walker talked about having grace and compassion in everything we're doing at this difficult time. Some final thoughts you'd like to share with the community?
Yeah, well, I'd like to thank staff who I know have been working, nonstop to address this issue. I know a lot of times we get, burrowed down into the details, but when we step back, the actions we've taken as a city are about saving lives. And I think we can look back and say that the actions we took have saved lives, and there's more work to be done. But I think we have been a state leader in terms of local municipal level responses to COVID-19, as well as to thank the people on the front lines dealing with this crisis, the grocery store workers, the nurses, the healthcare workers, firefighters, bus drivers, everyone else who is risking their life to keep our community still running, and the importance of thanking them not only with words, but as a locality, as a state, and as a country, providing these workers with living wages, good benefits, unions, the ability to collectively bargain. And I'd say as well that it's a very difficult time across the country, and certainly in Charlottesville. A lot of people are uncertain or fearful, but I'd say it's important to remember that the pandemic and everything that is going on. It doesn't mean that life is ending. It just means that life is going to be different, and that's an adjustment. But we can do it, and I think our strength locally is the strength of our local community. I think some of the most inspiring things that have been going on are the mutual aid work, the work from the community to provide direct assistance to our community, initiatives like supportcville.com, which are providing avenues to either donate or receive services if you need them. The continual work that's happening every day with our food banks, delivering meals to school children, strengthening our homeless shelters, etc. That's what our community is all about. And I think if there's any positive, it's showcasing our ability to come together as a community and work cooperatively. And, for folks who are, if you're feeling sort of in despair, I think one of the most important things you can do in terms of even just feeling better is to get involved with these community initiatives, because people are already making a difference. And even if it's just, even if you have 30 minutes a week to help, it really does make a difference. And I think that's the most important thing. It's not just a response from us as a city, it's a response for us as an entire community.
Thank you very much, Councilor Payne. We appreciate you joining the show today. Dr. Richardson, I think one of the things that was interesting last night was that, let me get the video back here. There we go. Technology. It worked pretty well last night.
Yes, definitely. Did a good job. Very good job.
One of the things I heard last night from council, and I've heard from you, is a lot of support for staff and concern about the welfare of our employees. And I think City Council last night not only concerned about the vulnerable populations in the community, but a lot of positive feedback to our employees. And as one employee, it made me feel good to know that they have our back and that they're thinking about us. So we appreciate all that support that you give your team. I want to talk about our show next Thursday, this Thursday, April 23rd at 11 a.m. The next Cville360 will of course get an update from Chief Baxter. And we will also be talking about 3 issues that have been impacted by the pandemic. Number 1, our local elections and our plan for the upcoming primary. Number 2, the U.S. Census. Remember when that was a big issue back last month? That's still going on. And then, very important, our mental health during the pandemic. So we're going to have 2 segments on the program. First, our voter registrar and a member of the electoral board will tackle elections and the census. And then we have a team of local mental health professionals that'll be on and available to answer your questions about mental health and the pandemic. And again, on Friday at 3 o'clock, the Thomas Jefferson Health District will have its town hall to answer questions about COVID-19. Please contact me with your feedback and ideas for future topics and guests. Thank you for watching, and please stay healthy.